important hearing. The drinking water crisis in Flint, Michigan is a national tragedy. It's a preventable man-made disaster that should have been intervened months before it caught the nation's attention. Most tragically are the estimated 8,000 children under the age of 6 who are exposed to unsafe levels of lead who may not need lifelong services to live fully productive lives. Childhood lead poisoning is a tragedy impacting communities throughout our United States. The Centers for Disease Control estimates that approximately 500,000 American children under 6 have blood lead levels above 5 micrograms, the level recommended for public health actions to be initiated. Children from low-income communities, communities of color like those in Flint, and communities I have the honor representing in Houston, Harris County, Texas, are 2 to 3 times more likely to have elevated blood levels based on CDC data. Then no child in America, regardless of background or income, should be a victim of lead poisoning. The city of Houston has been proactive on this issue. Houston is one of the 6 cities to be part of the CDC child lead poisoning prevention programs, with the ambitious goal of eliminating childhood lead poisoning in the city by 2020. In 2013 alone, over 24 children were screened for lead, and since 1996, nearly 3,000 homes have been remediated for lead paint. I support these efforts, but more must be done to ensure that every child is tested for lead and all older homes are lead paint free in Houston and across the nation. Unfortunately, the CDC program has drastically cut in recent years from $30 million in 2011 to $15 million last year. Health and Human Services, working with Congress, must ensure that this and other similar programs get resources they need to protect our children from lead exposure. The recent study conducted by the American Water Works Association estimates that there are 6.1 million lead service lines used nationwide, serving 15 to 22 million Americans. These lead service lines are greater concentrated in Midwest and Northeast. LSLs are found in every state. My home state of Texas is estimated to have 270,000 lead service lines still in use, 8th highest in the country. If we're going to eliminate lead out of our drinking water once and for all, our nation must commit to the comprehensive plan to replace lead service lines. This will necessitate coordination between water utilities, cities, states, and EPA, with a sizable commitment of resources from the federal government to support local communities and low-income households replacing their lead lines. I'm proud to join my colleague, Representative Paul Tonko, as an original co-sponsor of the Aqua Act, which would reauthorize Safe Drinking Water Act for the first time in 13 years and give states greater resources to update our nation's aging drinking water infrastructure by increasing funding for the state revolving fund. The Safe Drinking Water Act was passed by Congress 4 decades ago to ensure public drinking water supplies throughout the nation. It's clear today that our Safe Drinking Water Act failed to protect the people of Flint and other communities around the country. As the Committee of Jurisdiction, we need to know why. Much of the responsibility for the failure appears point to the lead and copper rule. LCR has not seen major revisions in 20 years. I'm very interested in hearing what EPA has done to modernize the lead copper rule and what revisions the public health and water utility experts, of course, today believe are necessary to ensure that our public water systems are lead-free. I hope that today's hearing will bring frank and fruitful discussion on these critical issues in public health, and that we find common ground moving forward to ensure that this terrible tragedy never hits another great American city. Mr. Chairman, I hope our committee will use our jurisdiction to the furthest and do our best to do. And I'd be glad to yield the remainder of my time to my colleague from North Carolina, Congressman Butterfield.
Thank you, Mr. Green.